bringing you back.
That's
it's
okay.
just to get what we expect as a nation and what we have on the ground.
Thank you very much. Like I've told you earlier, there's a great deficit in number of safe blood that we have currently. Worldwide, having a population of over 200 million Nigerians, we expect to have a minimum of 2 million safe units per annum. But as I speak to you, we have about 25,000 safe units in our record. And of course, there's a big gap between 25,000 and 2 million. So we really need Nigerians to volunteer to donate blood freely, because you never can tell who will need this blood. Accident does not announce when it will come. Disease like cancer does not announce when it will come. And renal transfusion or renal transplant and those such diseases does not announce when they will come. So we need to be prepared. People might think that there is no need to have blood in place, but they are required for emergencies. And we know that they don't just donate them and they are discarded, but they are useful to people who need them at any time.
Okay, sorry, sir. You mentioned earlier that there's also health benefits.
Yes.
Who do you do now? So what are some of the health benefits?
Oh, people who donate blood freely, they are revitalizing their own system. Because as you donate the old blood, new blood cells are being formed and your system is being regenerated. So there's a great benefit in being in good health when you donate blood. Equally, as you go to donate blood, you undergo clinical checkup. You undergo health checkup. Your blood pressure, your PCV, your sugar level, sometimes depending on your state of health, will be checked free of charge. You don't have to pay. So these are some of the free benefits you get through donation of blood. But the most important is that as you donate blood, you get old cells out of your system, because even if you don't donate this blood, over a period of time, these cells degenerate into the system. So as you donate to help others, you're also helping your health to become in good health.
The agency I'm heading, or I'm leading, is responsible for leading reforms and initiating reforms in Federal Republic of Nigeria. This agency that is hosting this event today is a product of reforms. And what we have tried to do is to see how we have and drive a coordinating strategy, which we call the National Strategy on Public Service Reforms, that covers every aspect of governance and service delivery with the focus of improving the quality of life of the common man on the street. The recent challenge around COVID-19 and others have indicated that our healthcare facilities need to be upgraded, and we need to do quite a lot around that. As it has been stated, blood is life. Without blood, nothing is going to happen. As a reform initiative, we'll continue to monitor, trace the activities of this agency to ensure that there is value for money and Nigerians benefit from what they are set up to achieve. We have a code of conduct in the public service that determines and directs our behaviors as government staff. And whoever errs, especially abuses that will lead to loss of life, the law will take its course according to the Constitution and the code of conduct that is supposed to determine and guide our behaviors as public servants. So definitely there will be penalties, and we encourage the agency to facilitate that so that whoever errs is penalized and will be able to deter others from doing the wrong things.